Good afternoon, everyone. Today is Friday, May the 22nd, and this is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. And welcome to the end of week 11 of the COVID-19 pandemic here in Montgomery County. Since our press briefing yesterday afternoon, we have had 105 new cases of COVID-19 reported today in Montgomery County, which brings us to a total of 6,312, 23 of which are from long-term care facilities and 82 of which are from the community. These positive individuals are from 33 municipalities. 61 of 62 Montgomery County municipalities are home to individuals with COVID-19. These individuals today range in age from 2 years old to 95 years old. And as always, you can check our municipal map at montcopa.org/COVID-19 for updated geographic information. Today we have 47 females and 58 males. 8 are known to be hospitalized. 6 are known to be at home in isolation, and we do not have information on the remaining 91. Now, I do have an announcement about today's data. As I have reviewed before, our intention has been to report positive cases only as a result of a positive test for the virus, not from the antibody test. The antibody test lets us know that someone had the virus, but it does not tell us if they have the virus right now. Due to recent news reports of the commingling of virus tests and antibody tests in certain databases, and from a question from a resident, I have asked our team to review our entire list of over 6,300 positive cases. As a result, we have identified 6 individuals who have been reported to you as positive for virus when in fact they only had a positive antibody test. These individuals have been removed from our total positive case count, and our municipal maps and other demographic data will be updated this afternoon to reflect this. To give you a sense, on April the 28th, there was an individual in Hatfield. On May the 9th, a second individual in Hatfield. On May the 13th, an individual from Red Hill. On May the 14th, an individual from Brynathan. On May the 15th, a second individual from Brynathan. And on May the 20th, an individual from Whitpain. So these 6 individuals are in the process of being removed from the demographic data that you'll see on our hub website. Training and process procedures have been put into place to ensure that all cases reported as positive are done so based on a positive virus test. I'm also saddened to confirm today that 8 more Montgomery County residents have lost their lives to COVID-19, which brings us to 566 deaths confirmed positive from COVID-19. 5 of these individuals passed away in a hospital and 3 in a long-term care facility. They ranged in age from 66 years old to 95 years old. Overall, we have lost 309 females and 257 males. The self-reported racial breakdown that we have includes 13 Asian, 3 Asian Indian, 2 Asian Korean, 59 African American or Black, 167 white, and 322 unknown. In terms of probable deaths today, and as a reminder, these are defined as COVID-19 listed on the death certificate as a cause of death, but not confirmed with a lab test. We have 185 probable deaths, So adding that to our 566 confirmed, that gives us a total of 751 Montgomery County residents that potentially, probably, or definitely passed away from COVID-19. And as a reminder, if we do get confirmatory lab data on a probable death, we do move them to the positive count. Our hospital bed situation continues to be relatively stable. Today, we have approximately 255 COVID-19 patients that are in our Montgomery County hospitals, with about 25% of them requiring ventilators. At our long-term care facilities, we continue to track the number of positive cases among residents and staff in 94 facilities that have reported positive cases to us. We now know that 497 of our 566 confirmed positive deaths of Montgomery County residents are individuals that lived at long-term care facilities. They represent 88% of our total confirmed positive deaths. We continue to do outreach to these facilities as we have described, and it is our understanding that the CDC teams will be here hopefully next week to join with our FAST teams to visit 4 facilities that have been selected by the Pennsylvania Department of Health. At our Montgomery County Correctional Facility, all inmates that have tested positive for COVID-19 are currently stable. Our Pottstown Walk-Up Community Test Site got up and running yesterday, so we're very, very pleased about that. This site is located at our Office of Public Health Pottstown Health Center at 364 King Street in Pottstown Borough. Testing will be available next week, Tuesday through Friday, from 11 a.m. until 1 p.m. by appointment only. To register for an appointment, call 610-970-2937, starting at 8:30 a.m. the morning of the day that you would like to be tested. The phone lines will remain open until 10 a.m. or until all time slots are taken, whichever comes first. There is a Spanish-speaking operator or a language line translator available. The Norristown Walk-Up Community Testing Site did close today because of the weather, but they will be open next Tuesday, weather permitting, and they are located at the Delaware Valley Community Health Center. All residents of Norristown Borough and all established patients of Delaware Valley Community Health Center, regardless of the municipality in which they reside, are welcome to be tested. Appointments for the Norristown site will open Tuesday morning at 8:30 by calling 610-592-0680. And finally, our Montgomery County Community College drive-through site is open and running smoothly. For the dates of April 16th to May 19th, we've now tested 6,532 individuals. We have received results on 6,167, which represents 94% of the total. 870 of these individuals have tested positive. So for 28 days of testing, we're running an average of 14% positive. Just a reminder that this site will be open tomorrow, Saturday, and you can make appointments beginning at 8 a.m. tomorrow morning at moncopa.org/COVID-19 by clicking on the green County Testing Information button, or you can call 610-631-3000. And again, that's at 8 a.m. tomorrow, Saturday. Now, this site will be closed Sunday and Monday. So tomorrow, the only site open is the community college site. Nothing will be open Sunday or Monday, and then all 3 sites will be back open Tuesday. I want to give you an update on our contact tracing team efforts. The county and our Office of Public Health contact tracing team is partnering with 4 trusted Montgomery County-based nonprofit organizations who have a long history of working with county residents of all ages, races, and backgrounds. ACLAMO, Family Services of Montgomery County OIC, and Visiting Nurses Association Community Services will all employ highly trained and skilled contact tracers to help stop the spread of COVID-19 in our community. Long before COVID-19, these 4 organizations have been working with Montgomery County residents on the ground level. Their staff are caring and compassionate professionals, and they have extensive experience in working with county residents during difficult times. Through COVID-19 contact tracing, they will not only help stop the spread of disease, but will also ensure that those individuals and families who are impacted will get the support and the services they need to stay safe and healthy. These organizations are fully equipped to reach our many diverse communities throughout the county, and they will play a vital role in our fight against COVID-19, and we look forward to working with them. Now, as summer approaches, I just want to share a little piece of some guidance that the governor issued just a few minutes before this press briefing started on summer camps and other recreational activities. As I have been mentioning, summer camps will be open. He also announced that an update on swimming pools. So according to this guidance, public bathing places and other outdoor community pools are permitted to operate in counties in the yellow and green phases of the governor's phased-in reopening plan, provided they follow CDC guidance for aquatic venues and the governor's guidance for businesses permitted to operate during the COVID-19 disaster emergency. So that is certainly good news. The other question that we've received many times is about organized team sports over the summer. And here's what the guidance said about that. Organized sports are only permitted in counties in the green phase of the governor's phased reopening plan. Organized team sports and events are defined as physical activity directed by adult or youth leaders that involves rules and formal practice and competition. This includes school and club sports, as well as youth and adult formal activities. Physical activity conducted as a part of summer programming is allowed. Activities and games with little or no physical contact are recommended. And professional sports are not covered by this particular set of guidance. So that gives you a little bit of update, and you can certainly look for the governor's full release. It shouldn't be difficult to find. So we want to give you an update of our positivity graph, as we call it. This is the graph that shows each day that a Montgomery County resident has tested positive for COVID-19 at any location. And the numbers of those positives are represented by those gray bars. And then the 14-day and the 7-day running averages of those totals that are represented by the various lines. The graph today is through May the 18th. So to go through this, the red and pink line at the top, those are our total positive cases. The red line is our 7-day average, and the pink is our 14-day average. And you can see at the far right side of that dark red line that it is ticking up a bit. And I've been mentioning this for the last several days. That we've been seeing the positivity rate start to increase a little bit at our testing site, at our drive-through testing site. So I really want people to be aware of this. You see that same uptick reflected in the blue lines, which are just the cases from the community. So they're from our testing site, and they're from any of the drugstore testing sites that have opened up, or any of our hospital testing sites. Anything that is not a long-term care facility. So again, while the 14-day average is pretty flat, which is that lighter blue line, The darker blue line is ticked up a bit. So I really want people to understand, I'm trying to show you in this way, that there's still a lot of virus in our midst, and that it is very important when you are out in the community to maintain social distance, to wear a mask, to protect yourself and others, and to keep those hands clean, to cover those coughs, all of these basic, very simple common sense measures that we've been talking about now for 11 weeks, they all still matter. And then the orange and yellow lines at the bottom are actually our long-term care facilities. So the darker kind of orangey line is the 7-day average, and the more yellow line is the 14-day average. And you can see that that line is actually dropped below the governor's metric of the 50 cases per 100,000. And I'm hopeful and optimistic that the work that our FAST teams have been doing on the ground in these facilities has really made a very, very important difference. So that situation seems to be very much moving in the right direction. But again, just want everyone to be fully aware that the community cases just are seeing a little bit of an uptick, and particularly as we go into this holiday weekend, just please be careful and mindful of that. And with that, I will turn over to Commissioner Lawrence.
Good afternoon. I'm going to share today announcements about the round 2 of the Montco Strong Small Business Grant Program. These awards are again being administered by the Redevelopment Authority of Montgomery County in partnership with the Montgomery County Department of Commerce. The $5 million available for the second round of the program includes funds from the Delaware Valley Regional Economic Development Fund and the Federal CARES Act. Round 2 of the program received approximately 2,900 applications requesting $29.3 million in grant awards, nearly double the amount of applications we received in round 1. Once again, we'd like to thank the Delaware Valley Regional Development Fund, chaired by former County Commissioner Tom Ellis, for their support of our Montgomery County small businesses. And we would also like to extend our thanks and appreciation to the Redevelopment Authority of Montgomery County for their continued partnership and collaboration on this program with our Department of Commerce. So a couple of statistics about the round 2 awardees so far. There are 81 grant awardees for a total of $893,000. And of these awardees, 70 of the businesses identified as minority or women-owned businesses, 20 identified as a veteran-owned business, 40 municipalities have at least one grant awardee. All the grant awardees have been contacted via email by the Redevelopment Authority of Montgomery County with grant contracting instructions, and the RDA will continue reviewing award applications through next week, and hopefully we will have everything awarded at the end of next week. But if you would like to see a list of the awardees, it is posted on our website at www.montcopa.org/MontcoStrong-SBGP. And I also have an update. This morning, the county announced that we are installing 5 secure ballot drop-off boxes throughout the county to help voters meet the deadline for the June 2nd primary election. Completed mail-in ballots and absentee ballots may be dropped off starting Saturday, May 23rd, and must be placed in the drop-off boxes by 8 p.m. on primary election day, June 2nd. Concerns over the spread of COVID-19 have created a high demand for mail-in voting, and mail delivery times have been slower than normal. Installing ballot drop-off boxes is another step we are taking to ensure ballots are returned to our office by the election day deadline. Ballots placed in the secure ballot boxes will be delivered to voter services daily, stamped as received. The ballot drop-off locations will be at the following locations: in Norristown at 1 Montgomery Plaza, 425 Sweet Street; in Green Lane at the Green Lane Park by the main park office; in Lansdale, the Montgomery County Community Connections office; Pottstown, the Montgomery County Community College at their Pottstown campus; and in Willow Grove at the Eastern Courthouse. And you can find complete information about the locations, hours of operations, and whether it's a drive up or walk up site on the Voter Services website at www.montcopa.org/voter services. Before you drop your mail-in ballot into the drop-off box, make sure you place your voted ballot inside the official return envelope, securely seal the official return envelope, and sign and date the back of the official return envelope. The deadline to apply for mail-in ballot is May 26th, but you're urging voters that if you want to vote by mail to apply immediately to ensure adequate time for delivery. Mail-in and absentee ballots must be received by the Montgomery County Office of Voter Services or in one of the drop-off boxes by June 2nd at 8 p.m. Postmarks do not apply. You can apply for a mail-in or absentee ballot at www.votespa.com. And for more information about the June 2nd primary election, including the ballot drop-off box locations and the updated polling locations, you can visit www.montcopa.org/voter services or call 610-278-3280. We have also had at least one media report and a few calls from voters who have received an incorrect ballot. And if you received an incorrect ballot, you should call Voter Services at 610-278-3280, and they will immediately void that ballot and get you the correct one. We are looking at how this happened, and we are looking to make sure that it does not happen again. And we apologize to any voters who have received an incorrect ballot. And with that, I'll turn it over to Commissioner Gale.
Good afternoon, everyone. This is Commissioner Gale. Thank you for joining us today. The state of Pennsylvania has granted an additional extension for license to carry firearm permits. Permits which expired on March 19th or later have now been extended to July 31st, 2020. The previous extension date was set to expire on May 30th. Again, it is now extended to July 31st. The extension of license to carry permit expiration dates is necessary due to the closure of some county courthouses and sheriff offices. A license to carry firearm is required to carry a firearm concealed on one's person or in a vehicle. In Pennsylvania, an individual 21 years old or older may apply for a license to carry firearms by submitting a completed application to the sheriff of the county in which they reside. If you are a Montgomery County resident interested in applying for a gun permit, please visit the Montgomery County Sheriff's Office website at montcopa.org/sheriff's office. Again, that website is montcopa.org/sheriff's office. Be aware that there may be limited operations or special instructions due to the COVID-19 pandemic. Thank you again for listening today, and I hope you all enjoy a nice Memorial Day weekend. And with that, I'll turn it over to the press.
Actually, before we take questions, today we are celebrating the end of EMS week, and Dr. Al Wong is here to join us to talk about that.
Thank you, Commissioner. So before we proceed with our EMS week announcement, the Department of Public Safety would like to express our sincere condolences to the coworkers, friends, and family of firefighter EMT Jeremy Emmerich, who passed away yesterday after a courageous battle against COVID-19. Jeremy worked for numerous EMS agencies, including Skippack EMS, Lehigh Valley Medevac, and Valley EMS. He was a member of the Fleetwood and Exeter fire companies. In addition, he was a veteran of the United States Army who served in combat overseas. And on behalf of the commissioners and the entire Department of Public Safety, we thank Jeremy for his dedication as a frontline hero and mourn the untimely loss of his life. So tomorrow we'll close out EMS Week 2020. The tradition of EMS Week began in 1974 under President Gerald Ford in recognition of EMS practitioners throughout the nation as the critical work that they do in our communities. The theme for EMS Week this year was Ready Today, Preparing for Tomorrow. And this is particularly meaningful as we see our county's EMS agencies rallying together to support the COVID-19 crisis while still responding to the everyday emergencies that happen in our community. By the end of this week alone, our Montgomery County EMS agencies will have responded to nearly 1,000 911 calls for service. Montgomery County is home to more than 35 EMS agencies, including 911, public, private, and air medical services. These agencies are staffed by over 1,600 EMS practitioners, which call Montgomery County their home. These dedicated and highly trained EMS workers have endured challenges far beyond what we would expect them to endure in the face of this pandemic. They rose to accept this challenge by quickly adapting to changing clinical guidance as we learn more about this disease, and endured the same hardships the rest of our community faced with the necessary closure of schools, while they, like other essential workers, continue to find innovative ways to go back to work so they could continue their service to the public. Some of them became personally ill from the coronavirus. Some of them have had to continue working day and night while mourning the loss of their coworkers, such as EMT Jeremy Emmerich and paramedic Kevin Bundy, to the very disease that they are working so hard to mitigate. So on behalf of our county's leadership and Department of Public Safety, please allow me to express our sincerest gratitude to these EMS agencies and our dedicated EMS practitioners for their continued selflessness and professionalism. To the members of the public, I urge you to support your local EMS agency. These agencies depend on limited reimbursements offered by insurance companies to cover their operating expenses. Unfortunately, these reimbursements often do close to the actual cost needed to maintain operational readiness 24/7, 365. And as a result, local municipalities often have to step in to subsidize their operations. In addition, there is a shortage of EMTs and paramedics in our EMS workforce nationwide. So if you're considering a new career, please know that our Montgomery County EMS Training Institute is open for enrollment. You can become a certified EMT with just 170 hours of instruction delivered in a socially distant format. If becoming an EMT or paramedic isn't for you, I still encourage you to learn to save a life by taking classes on CPR, Stop the Bleed, and naloxone administration. And as I mentioned in my previous comments during Stroke Awareness Month, if you are having a serious medical emergency, please don't hesitate to call 911. Our 911 telecommunicators are trained to give you simple instructions over the phone about how to help. Our EMS agencies are well-staffed and equipped with the latest technologies and treatments to bring many aspects of emergency department care right to your front door. And they can continue those same treatments during transport to the emergency department. You're not imposing on us. We're here to help. So if you're having serious signs or symptoms such as chest pain, shortness of breath, or stroke-like symptoms, don't wait at home to see if things get better. Call 911 right away. So again, as we close out EMS Week 2020, please let me express our county's sincerest appreciation to our EMS agencies and dedicated EMS professionals for your continued service and calm professionalism in the face of uncertainty. We and the members of the public owe you a debt of gratitude for the sacrifices you have all made to keep us safe. Thank you very much, and best wishes for a happy Memorial Day weekend.
Thank you, Dr. Wong. That was lovely. Really appreciate that and appreciate all the work that you do every day in leading our regional EMS efforts and the extraordinary amount of work that you have done in the last 11 weeks as we put together our response to this COVID-19 pandemic. So thank you to you and all of your colleagues. I also just want to wish everyone a wonderful and safe Memorial Day. As we've announced before, we will be lighting the courthouse red, white, and blue. We will be placing 72 black masted flags on the green in front of the courthouse, each flag representing 1,000 veterans that have been laid to rest here in Montgomery County. And please check our social media sites over the weekend. There will be a virtual online tribute to many local Montgomery County veterans. And then, as we've also announced, the flags that we wished we could have released for Monday, Memorial Day, we postponed that to the 4th of July holiday when it hopefully, and it should be, a much safer time to gather to distribute those flags. And those flags will be distributed in June. And with that, I will turn over to the press for questions.
Thanks, Commissioner. This afternoon, we're joined by Carl Hessler from the Pottstown Mercury and Deanna Durante from NBC 10. We will start our first round of questions with Carl. Carl?
Dr. Arkush, County Salary Board on Thursday accepted the resignation of Dr. Brenda Weiss, the County Administrator of Public Health. Was Dr. Weiss's resignation sudden, and what impact will it have on the operation of your public health strategies as you continue to address the pandemic moving forward?
Dr. Weiss's resignation was not sudden. She had shared with me on a couple of different occasions her desire to be closer to her daughters. She's actually accepted a position in another state where two of her daughters reside. So we absolutely wish her the best and hope that, this is a great situation for she and her family. And we are very pleased to announce that Janet Panning is taking over as the interim administrator for the Office of Public Health. We were pleased that Secretary Levine let us know today that after our Board of Health approved this, it goes straight to Pennsylvania Department of Health for their approval. And Secretary Levine let us know today that that appointment was approved. So it will be a very seamless transition. Janet's been involved in many of the activities, just as we all have over the last 11 weeks in our county's response to COVID-19. And we don't think that we'll miss a beat. So we will miss Dr. Weiss, and we certainly wish her the best.
So is Dr. Panning is now the administrator, or is she the interim administrator?
Interim administrator.
Are you going to be advertising a vacancy in that office, and have you done that already?
I don't believe it's been advertised yet, but it is our intent to advertise a vacancy in that position.
Okay. On another subject, the contact tracers. Do you know how many tracers will be employed by the agencies that you are going to be collaborating with?
Yes, each agency will have one supervisor, and I believe it's between 5 and 10 contact tracers. And then we will also have 10 individuals that are current employees in the Office of Public Health that are done, I believe, at this point with their training on the new system that the state has provided, and will begin contact tracing next week.
Okay, thank you, Dr. Akush.
Thanks, Carl. Next, we'll hear from Deanna Durante from NBC 10.
Good morning, everyone, or good afternoon. I did that yesterday too. We know that the governor did release information on when counties go to yellow having to do with pools and childcare. There was some confusion, perhaps. He talks about community pools. He talks about parks that have to do with childcare. Is this all pools everywhere that you know of?
Deanna, honestly, I glanced at the release about 5 minutes before this press briefing started, and I literally pulled the language from the release into what I read to you. So as of right this minute, that's all I have.
Okay. I just know that that's a very big question.
That's why I gave you what I had, because I know.
And I have contacted the governor's office, but again, they've been very vague on it. As you are aware, you addressed the antibody testing numbers. And yesterday I had asked you about some nursing home numbers. There's been more reports out today that the Secretary of Health has acknowledged that there were some errors. And with, again, the numbers being a very hot topic, point of contention with people, how do we know if our numbers here in Montgomery County are accurate? For example, there were deaths posted at one nursing home, and then the state changed the data to remove those deaths. So I just wanted to touch base and ask you about that.
So to be clear, I can't speak to DOH's process, and I did not see the Secretary's press briefing today, so I can't speak to what she said today either. But I can speak to what we're doing. And so we go through a very cumbersome and lengthy process every single day of reviewing in the PA NEDS system, which is the state database, any individual that is got a Montgomery County address in that system or is attributed to a Montgomery County address and has a test for COVID-19. And I will clarify again, we did have an error on 6 people, but we have a process in place now to prevent that from happening. So those cases get pulled down, and then we go through a process of checking every address to make sure it is actually a Montgomery County address. We, with the long-term care facilities in particular, it can be quite confusing because sometimes if that facility is associated with a hospital, sometimes they actually put in the hospital's address rather than the facility's address. So it's just a process. But my staff does everything they can to make that data as accurate as they can. And so the numbers that we report to you, which are the totals, to be clear, we have not reported by facility because the Department of Health is the one that made that decision about those facilities, whether or not to report by facility. They are the licensing and regulatory authority for those facilities. But we believe that the total numbers that we are sharing with you are as accurate as possible, both on the positives and with the deaths.
Are you able to comment if you've received word about our county status moving from red to yellow?
Well, what I can tell you is that I think that Montgomery County residents will find the governor's 4 o'clock press briefing to be of great interest. So I encourage you to watch it. And secondly, I will just reiterate that, as I've mentioned many times, I have been in regular communication with the Pennsylvania Department of Health and the governor's office. I have been sharing our data with them. I have been suggesting ways of considering our data, particularly given that here in Montgomery County, we have 70 licensed long-term care facilities. Compare that to Philadelphia that has, I think, 40 or 45. So we have a very high concentration of these facilities. So we've been in regular and constant communication, and I have shared with the governor's office and Pennsylvania Department of Health that I believe that our data demonstrates that we would be ready as a county to go to yellow on June 5th when the governor's current order expires.
And on the voting question, and again, another big social media topic to make sure that ballots are correct. If ballots are mailed to incorrect addresses or incorrect people and or the wrong ballot is sent to you, Commissioner Lawrence just said that you can call voter services, but what if somebody chooses not to and use the ballot? How can you be sure that that erroneous ballot out there doesn't get filed twice? Is there a process in place for that?
There's definitely the markings on the ballot, so someone could not vote twice and use an erroneous ballot twice. That could not happen.
All right, thank you very much.
Thanks, Deanna. Any further questions from either Carl or Deanna?
No, we're good.
Anything else, Todd?
No further questions.
All right, everyone. We are going to issue a press release tomorrow, and we will not then be back with you until Tuesday. We are not going to issue a press release on Sunday or Monday. So we will see you Tuesday at 3 o'clock, and have a safe weekend. Thank you, and happy Memorial Day.